A bowel obstruction is when usually the small bowel is kinked off and or knotted, or just not, things aren't flowing through. So what happens is oftentimes after somebody's had an operation, normally a big open operation, where they've had like maybe the colon removed or an open gallbladder, or a pelvic operation like a hysterectomy, so that's removal of the female organs. What can happen is any time after that, the scar tissue can include the bowel and then can choke it off. Symptoms include nausea with vomiting, bloating, increased abdominal girth. And how it's diagnosed normally is by CAT scan, sometimes just by x-ray. And most of the time, maybe 60%, we don't have to operate. Usually we can put a tube in the nose and drain the stomach and the patient will get better. But sometimes we can find a bowel obstruction when there's a hernia, say around the belly button or in the groin, or even in an incision, and the bowel is stuck there and has formed some sort of a knot or a knuckle, and the only thing to do is to operate. So sometimes we have to repair the hernia, or sometimes we have to go in with a laparoscope where we put the small holes through the abdominal wall and take the instruments and try and cut the scar tissue to open up the small bowel. But the operation just depends on how sick the patient is. Also, there can be bowel obstruction secondary to large gallstones that can completely block off the small bowel at the very beginning. So treatment is normally conservative. That means nothing by mouth, nothing to eat or drink, nasogastric tube decompression, and sometimes plus minus antibiotics, but definitely IV fluids. And then we just watch and see.